All right, everyone. So the whole reason for career sessions like today is because realistically, when you leave education, you're likely to spend more time at work and with the people you work with than you do with your own friends and family. So it's really important that you give a lot of thought to your future career, but it's also important that you enjoy this process. So I really hope that you enjoy this session today. When it comes to thinking about your future career, there are a lot of questions that need answering. What do I want to do for a living? So I'm going to share my screen now, bear with me. Hopefully you can see that okay. I think, yeah, and you can, there we go, look at that, wonderful. So what do you want to do for a living? What skills do I have? What skills do I need? What would I like to learn? What am I interested in? And what matters to me? And what we'd like to do on this panel today is encourage you to steadily, over time, don't feel rushed, to learn lots about a variety of different careers so that you can make an informed career choice. So my first question today to Susanna, who's on our panel. Susanna, how can you explain to the attendees today, what is an informed decision?
It's an interesting thing, isn't it? We all go into careers and we think we know what it is. And it's not really until we dig down and we work further that we really understand what our job is. And work experience can really help us understand that before we train. I was speaking to a colleague just yesterday who said that she'd spoken to many students about career choices they'd gone into, and they hadn't until they started the training really appreciated how much of anatomy they had to learn, and that it actually then put them off doing the course. And perhaps if they'd understood that beforehand and had that informed choice about the career they were going into, they might have picked something different. Therefore, there are lots of ways that we can get informed choice, and work experience is not the only way. There are lots of relevant experiences. Michelle, if you just want to bring them all up together, that's absolutely fine. So one of them is around attending careers events like this to learn about different careers. There are lots of online options that are coming available as well as things have changed. So, Google and have a look around. Professional bodies have lots around what their professions are, what it means, and what the training is. There are podcasts that now are available and different mediums that you can get involved in. Work experience is obviously a really good one, and that doesn't necessarily always need to be face-to-face work experience either. There are virtual opportunities available, and sometimes it's just as easy as spending time speaking to a clinician about what does their job really entail, talking about their normal days, their bad days, their good days, and what it means to them. It gives the ability to have insight into different roles. And also what's really important is to think about, if you're interested in occupational therapy, don't just think about occupational therapy. Have a look around the other healthcare careers that are around there, because some are more commonly known than others. So speaking to a wide range of clinicians. Also consider doing volunteering, and I know there's a session after this on volunteering, or is there part-time work that you can take on? And don't just consider the NHS as well. Our private sector has a huge number.
It was all fine, then
so
it just
that should be really good.
Hi, sorry, it's Sam here. Hey Sam, you're right.
Hey, yeah, good, thank you. I'm so sorry about this.
Okay.
So in the bottom corner of Zoom...
Sam, mute yourself, please.
Sorry.
Carry on, Susanna.
Sorry. So effectively what I'm trying to say is look around, try different things. Don't just consider one avenue. Try lots of different things so you really get that informed choice of what's happening and what the career is. Thank you, Michelle.
Thank you, Susanna. We are problem solving today, aren't we? What a wonderful team. Okay, so my next question for the panel. Healthcare is all patients. And because this session is about work experience, I thought perhaps the best question would be, who are the patients I could expect to meet if I went on work experience with you as an allied health professional? So tell me about the patients you see, their conditions, and the way that their lives are impacted by your work. I'm going to pose that question to Clare, first of all. Clare, would you like to introduce yourself? Don't forget to pop yourself off mute, and tell us a little bit about the patients you meet.
Hi, everyone. I hope you can hear me okay. My name is
Wonderful,
Clare,
yes,
and
Clare.
I am Brilliant. I am a neurologic music therapist, and I also work for the British Association for Music Therapy. So as music therapists, we work across the whole lifespan. So we've got music therapists in the UK working in neonatal units all the way through to end of life palliative care. So you can imagine that there's a lot of variety in the work, and it will really depend on who you're shadowing as to what client group you'll see. So for example, myself at the moment, one day I work in a school with teenagers with complex learning difficulties. The next day I work in the community with brain injury patients. So there's lots and lots of variety in our line of work, and if that's something that you particularly enjoy, then shadowing a music therapist would be a great option for you. And as I say, it will really depend on, you know, the person that you shadow, and we work with music using it in lots and lots of different ways.
Okay, thanks, Claire. That's really interesting. I've never spoken to a music therapist before. Jo, do you want to tell us about the patients that you meet and might meet day to day and the impact that your work has on those patients?
Good morning. I am Jo Small, and I'm a therapeutic radiographer, and we use post-radiology radiotherapy to cancer patients. Radiotherapy can be used in conjunction with surgery and chemotherapy. This is not metric and patients.
Oh, we're facing some difficulty hearing you, Jo. Apologies for interrupting you. I don't think we can hear you at all now, so I'm going to move on. Charlotte, if you want to tell us about the patients that you meet and your role, pop yourself off mute, and hopefully we won't experience the difficulties.
Hi, yes, thank you. Hopefully you can hear me all right. My name's Charlotte. I'm a dietitian, a community dietitian working for Nottinghamshire Healthcare Trust. So the patients that you might come across on work experience will depend on sort of whether you're shadowing a dietitian in the hospital or in the community, as well as sort of what the service is commissioned to deliver. So for instance, you can meet an oncology dietitian working with patients with head and neck cancer, or home enteral feeding dietitians working with patients with neurological conditions that may be fed via a tube, for instance. So sort of in the community, I see infants with cow's milk protein allergy, faltering growth, obesity and under 5s, and also autism. So in terms of the adults, I see type 2 diabetes, malnutrition, pressure ulcers, irritable bowel syndrome, and also celiac disease. So malnutrition, specifically undernutrition, is a predominant condition that I come across. And there are many reasons why someone may lose weight. This may be due to sort of increased nutritional requirements related to, say, liver disease, or maybe sort of have a social cause related to, say, lack of social support. So good nutrition can play a key role in not only prevention, but also treatment of disease. Undernutrition can have a negative impact on all bodily systems, on, say, skin integrity, muscle mass, or, for instance, have a negative psychological impact. By providing tailored nutrition support, dietitians alongside other healthcare professionals can play a key role in reducing the risk of, say, pressure ulcers, that skin breakdown, improve muscle strength, thereby reducing the risk of falls, reducing the risk of infections, preventing hospital stays, and also just improving general sort of health and well-being. So good nutritional care can have sort of wide-reaching benefits.
Wow, Charlotte, goodness me, that's a lot more than I was expecting. I'm learning a lot today. This is great. And finally, out of our panel today, Suhailah, would you like to tell us about the patients that you meet in your role? Just make sure you're off mute. Oh. Having some trouble hearing you as well, Suhailah, sorry.
Is this any better?
Oh, can hear you.
Is it clear? Hopefully there's no
yes,
feedback.
You're lovely and clear. Go for it, Suhailah. Wonderful.
Thank you. Morning, everyone. My name is Suhailah Mohamed. I'm an occupational therapist. I work for the East London Foundation Trust, and I work in secondary mental health care. And what that means is I work in a mental health hospital, an inpatient mental health hospital for people who have severe and long-lasting mental illnesses. And if you are to come and do some work experience or some shadowing with me or somebody in our team, then you're likely to work on a single-sex ward. That means the wards that we have are either for males or for females. And you'll tend to be working with very young people, normally between the ages of 18 to about 50. I work on a male psychiatric intensive care ward, so I tend to work with young men between the ages of 20 to 30 who live with a range of mental illnesses, from psychoses to mood disorders, or bipolar affective disorder might be a common one, or personality disorders. And I work with these individuals really to try and assess their daily living function. So what are their skills? What are their abilities? What are their aspirations when it comes to daily life? And I help them integrate back into their communities in a way that is meaningful for them. So for example, some of these young people might have aspirations around study, and that might be study at college, it might be an apprenticeship scheme, or it might be at university. And I support them in a very practical way, breaking down tasks to help them achieve those goals. Some people may have aspirations around their housing, or some people may, in addition to living with their mental illness, also have some physical disabilities. And in that case, I might do some adaptations in their living environment so that they can continue to live an independent life that makes them feel fulfilled, makes them feel like they belong in their society, and makes them feel like they are able to achieve the goals that they aspire to further down their lifespan. Thank you.
Wow. So, I mean, it makes me want to go on work experience with all of you, because the impact that you're having with your patients and the conditions they face is very different to what I had imagined. Thank you so much, everyone. So our next question is specifically for the panelists who are currently studying to become allied health professionals. So my question to you is, did you do work experience yourselves? What did you learn from those experiences, and anything you'd like to share with us about your journey into your current study? I'm going to pose that question to Angie first. Angie, if you'd like to introduce yourself.
Hi there, I'm a third year physiotherapy student at the University of Brighton. I'm currently on a placement now. So I did do work experience, and I would say that when you're going into any career choice, do spend some time getting some work experience, be that a day shadowing or a week shadowing or speaking to someone on the phone. So I kind of did all those things, and I took it upon myself to contact as many organisations and people as I could, starting with my local hospital. And I was able to secure a week shadowing the physiotherapist there, and went around with them for the week, actually looking at the different departments. I also did some volunteering to get some work experience in a osteoarthritis knee clinic, and it was basically helping to set up, and put away, but also you sit in on the education systems. And what I really found useful from this work experience is you really get to see how a physio works, so what they do in a day, kind of people they work with, so the OTs and the doctors, and you really get a feel for, I guess, the environment they work in, and it's a really good environment. So obviously I'm biased, but it's a really good environment. So I'd say definitely just contact as many people as you can, and things like, if you know anyone that's in that role, ask them questions. It's always about asking questions and trying to get that information before you make those decisions.
That's great. Thank you, Angie. And Afreen, do you have any advice for our attendees today? Did you do work experience yourself?
Hi, yeah, I did. And I'm similar to Angie. I'm a third year student, and I'm based in Brighton, and I'm currently on placement as well. And I did 4 days in a hospital and 1 day in a private setting. And I found that really useful to have those two different experiences to kind of compare and see what it's like. And yeah, work experience, you're able to see how physios work and how they can communicate with patients, how our treatment is effective for them, and the other disciplines that they work with. So it was really good to have that kind of insight into it before making a decision of whether this is the career choice for me or not.
That's great, Afreen. Thank you so much. And Molly, would you like to introduce the course that you're studying on and provide any guidance to our attendees today?
Yeah, so hi, I'm Molly, and I'm a final year dietetics student at the University of Chester and the current student representative for the British Dietetic Association. So I did work experience in my first year of university with the community dietitians in Liverpool, and this involved visiting care homes, residential homes, clinics, multidisciplinary team meetings, and education sessions. My experience covered a range of areas, including weight management and diabetes, enteral feeding, and nutrition support, particularly for the elderly and patients with cancer. My experience highlighted how important the role of a dietitian is, and with Liverpool being a rather diverse city, it enforced the importance of multicultural competence regarding food choices and how important tailoring nutritional advice to a patient is to promote effectiveness of intervention. In addition, I was able to appreciate the role of a multidisciplinary team ensuring the delivery of effective care with aspects to all clinical importance and understanding how diverse the role of a dietitian is.
That was fantastic. Thank you, Molly. Thank you, everyone on the panel, for that question and answer. So my next question, let's see if this works. I want to go to every panelist and ask them for their top tip. How can I prepare for a work experience placement? So Susanna, we'll go with you first.
Hi, thank you. I'm hoping you can hear me. So the way I would prepare is to make sure that you pick the place, first of all, when you first do work experience, that is close to home, because actually there is nothing worse being able to get there or having challenges in getting there. So pick somewhere that's easy for you to get to.
It's great. Thank you, Susanna. What would your top tip be, Claire?
Hi, my top tip would be do your research on the client group that you know you'll be working with on your work experience, and be prepared to listen. So, for example, if you were going to go and shadow a music therapist who is working with patients in the latter stages of dementia, just being aware of the difficulties for that client group, and also just being prepared that tiny moments in those sessions, whether it's just moving a finger, these tiny little things are actually really significant. And if you don't know a bit more about the population and that condition, it can be really easy to miss these significant moments. So definitely do your reading and come ready to listen and learn.
Fantastic guidance there. Thank you, Claire. Angie, what would your top tip be?
So I would prepare questions that you want to ask when you're on the work experience that are really relevant to that area that you're interested in, and just be ready to ask away, knowing that you want to get those answers before you go.
Brilliant. Preparing questions. I love it. Afreen, do you have a top tip for the audience? Are you still on mute, Afreen? Sorry, I might have caught you off guard.
Sorry, yes, I was. Sorry.
There we go.
Yes. A lot of the tips have been said, so I can't think of something off the top of my head, but I can say something that might be useful for when you are on work experience. So you might find how to introduce yourself to patients. So just thinking about saying who you are, that you're a student, and if they're happy for you to observe them while you're shadowing the professional that you're with, that might be quite useful.
That's really good advice, Afreen. Absolutely. Patients are likely to confuse you for a member of staff, so you have to be ready to say, I'm here as a work experience student. That's great advice. Jo, I'm hoping that we'll be able to hear you. Let's give this a try. Do you have a top tip for the audience?
Can you hear me this time?
Yes, Jo, lovely.
Yay! I would prepare yourself for the unexpected. Clinical settings are very, very different from anything that you'll have experienced before, especially in radiotherapy where you're dealing with cancer patients. They might have adverse reactions, and some of the side effects can be quite scary to non-clinical professionals.
That is a really good top tip. It's sort of being emotionally prepared, Jo. I like that a lot. Charlotte, did you have a top tip for the audience?
Yeah, I'd say sort of just find out about your local sort of dietetic department, and also perhaps just look on the website of sort of this trust or the hospital, and just find out sort of key things like the key values and what sort of services they deliver, so you're well prepared.
Wonderful. I think I've caught everyone off guard by going in a strange order with this, but Molly, are you there, and would you have a top tip for everyone?
Yeah, so I'd say if you have the time, create some summary sheets on a range of topic areas so that you can quickly refer to them when you've obviously got minimal time, and this will just help you to refresh your memory.
Lovely, Molly. And finally, Suhailah, have you got a top tip for the audience today?
Yes, I have. I don't know if I can champion a lot of what's already been said, but my top tip is to make sure you get plenty of rest and to eat well. You cannot underestimate, I guess, the drain. You know, you mentioned there the emotional kind of toil that work experience could take, and I guess the drain on your body that comes from learning and going on to learning something that you know very little about, or is might be something you know nothing about. So plenty of rest. Good, at least in your 8 hours sleep, and of course a good nutritional diet, just to make sure that you can keep going and you have the stamina to sort of see you through a good learning experience, as it were. Thank you.
Wonderful. That is a fantastic final top tip. Brilliant. So my final question, and I'm going to come back to Susanna for this one, is we mentioned a whole host of relevant experiences as well as work experience today. So there's two-part question. Can you recommend any specific relevant experiences where the audience could find out more about allied health professions, and where specifically could they look to find opportunities, specifically work experience opportunities?
Thank you, Michelle. So as I've said, if you automatically Google allied health professional careers, you will have a range of information that comes up. I Can See is a website that has lots of information on and is really good for that, as is healthcare careers. And it will take you through a range of different choices. If you go into healthcare careers as well, you can also look at, you can do a survey and it will come up with different careers that might suit you. So that's a really good one. The WOW show has some brilliant videos that will have clinicians talking about different careers. BBC Bite Size as well, something that people don't often think about going onto as the BBC website, but it does have opportunities. So have a look around and see. If there is one career that you're interested in, there are some that have got virtual reality opportunities on. So again, go and see them. They're great to see, particularly actually if you're not sure about some careers and you don't really know what it is. All of these give you opportunities without having to do work experience, just to find out a bit more. Because sometimes when you go and do work experience, it's good to have a bit more insight, as we've already discussed, into them, so that you know you're picking the right thing. So using the websites to identify some of those key areas is really important. And then when you go to try and find work experience, email your local organisations. Both either their HR departments, their communication departments will very often send them on, or just a local team to find out how you can get work experience with them. Thanks, Michelle.
No problem. Thanks, Susanna. So I have posted into the chat of this session links to each of the images that you can see on the slide at the moment, if you'd like to look into those a little bit more. And as we said, there's a lot of new online alternatives to work experience, which are coming out and emerging and have been for the past few months. So I have no doubt that new things will be developed next year as well, because there's this new opportunity to provide you with online alternatives to work experience as well. So that is everything that we had prepared. I am just now going through the questions to see if there was any specific questions for the panel. I know we are quite a few minutes late. I haven't seen any specific questions. I don't think there's any specific questions for the panel. I think we are actually finished the session for today. I'd like to
Thanks, Michelle. That's been really good.
Oh, thank you. Yes, everyone. I know there's been some technical difficulties there. I really hope that some of that information is useful to you, and we honestly do wish you all the very best with your future career searching.